We will now see about astigmatism. Astigmatism is the common optical defect that interferes with eye's ability to focus sharply. It is a refractive error which is caused by the unequal refraction of light in different meridians. The cornea of the normal eye has a uniform curvature resulting in equal refracting power over its entire surface. However, in some individuals, the cornea is not uniform and the curvature is greater in one meridian than the other. It is like the difference between a football and a rugby ball. The light rays refracted by this cornea are not brought to a single point focus, and the retinal images from objects both distant and near are blurred and may appear broadened or elongated. Astigmatism in an eye is the refractive error where the rays that are travelling in two different perpendicular planes have different focus points. The term comes from the Greek meaning without a mark. A uniform curvature is needed to have equal refractive power over the entire surface. But if the surface is not regular for a perfect round, two rays of light passing through the cornea get refracted differently and so focus to a point at two different places. This irregular shape prevents light rays from focusing on the retina. The image as it falls on the retina is not sharp, more like an out of focus picture. The image is blurred and indistinct. It is more disabling when we take pictures using a camera. The photographer will be able to appreciate the difficulty better as he fiddles with the focusing range to obtain a perfect focus. Vision of the affected eye may be blurred at all distances, not necessarily either near vision or far vision. The images appear broadened or elongated. Straight lines coming in one direction will be blurred than the line coming from another direction. To amplify further, a person looking at the window might find the horizontal edge clear but the vertical edge blurred. Most people have some degree of astigmatism. If the problem is very minute, they may not notice it. Children may not even realize that they have a problem. If the problem exists from birth, the person may not know at all. Despite extensive research, the exact reason that causes astigmatism is not known. Heredity is said to be the most common cause. The genetic trait may also explain why many young children are affected by this condition. Unlike presbyopia, which affects only the old ones, astigmatism can affect people of all ages. It is also proved that astigmatism really does not occur alone. It always occurs in conjugation with myopia or hyperopia. Contrary to popular belief, astigmatism does not come by reading too much or reading in dim light. Like presbyopia, astigmatism is also a defect and not a disease. Astigmatism can be broadly classified as regular and irregular. It can also be classified based on various other factors. Now let us try to see each of the classification in detail. The first classification that we are going to see is the one depending on the etiology. Astigmatism can be classified as corneal, lenticular, and retinal astigmatism. Corneal astigmatism is the result of abnormalities in the curvature of cornea. Lenticular astigmatism may be due to the curvature abnormality as in lenticonus, positional abnormality as in subluxation of lens, or index astigmatism as in nuclear sclerosis. Retinal astigmatism, which is due to oblique placement of macula, is rarely seen. The second classification that we are going to see is based on the axis and the angle between the two principal meridia. It is classified as with the rule astigmatism, against the rule astigmatism, oblique and bi-oblique astigmatism. With the rule astigmatism is the type where the two principal meridia are at right angles to one another, but the vertical meridian is more curved than the horizontal. In against the rule astigmatism also, the principal meridians are at right angles to one another, but the horizontal meridian is more curved than the vertical. In oblique type of astigmatism, the principal meridians are at right angles to one another, but are not the horizontal and vertical meridians. For example, 45 degrees and 135 degrees. We see that both the meridians are at right angles to one another, but it is not the 90-degree axis and 180-degree axis. Bi-oblique astigmatism is the type where the two principal meridia are not at right angles to each other. Yet another classification is based on the position of the two focal lines in relation to the retina. It can be classified as simple, compound, and mixed. The simple and compound can be further classified as myopic and hyperopic. In simple astigmatism, one image falls on the retina and the other falls either in front or behind the retina. So, if one meridian focuses the light on the retina and the other in front of the retina, it is called simple myopic astigmatism. Simple hyperopic astigmatism is when one meridian focuses light on the retina and the other theoretically behind the retina. The next type is compound astigmatism, where both meridians focus either in front or behind the retina. Compound myopic astigmatism is where the both meridians focus light in front of the retina. Compound hyperopic astigmatism is where both the meridians focus light theoretically behind the retina. The third variety is the mixed astigmatism, where one meridian focuses light in front of the retina and the other behind the retina. What problems do patients with astigmatism face? Astigmatic vision is never sharp and precise. It doesn't matter whether a person is looking at a distant object or training his eyes for near vision. The straight lines running in one direction may be more blurred than lines running in another direction. Along with indistinctness of the objects, shapes too can look different. The circles may get elongated and look like ovals. A point of light may appear to have an indistinct stay. This would be the first and foremost symptom that may indicate one has a problem of refractive error, of astigmatism. It is said that most people are born with some astigmatism, but the actual error may be so small that it is not noticed. The mild version may cause blurring only at certain distances. Continuous blurring of vision or distortion would be because of severe astigmatism. Further complications arise because astigmatism almost always accompanies other refractive errors. Headaches with no other causes are generally due to astigmatism. The brain struggles to cope with the continuous stream of blurred images. Trying to make sense of these indistinct images puts undue stress on the brain, and this almost always results in headache. The strain on the eye is tremendous, and this additional effort to focus clearly can cause serious fatigue. Some people also try to adjust to the blurred image by squinting. Continuous contraction of the muscles around the eye and frowning the eyebrows in order to concentrate better are subconscious cope-up mechanisms in the body. One may not even be aware that such changes happened while trying to decipher the blurred images seen by the brain. The excess strain on the eye may result in irritation and burning. Many people with astigmatism have difficulty in driving after dark. The indistinct images may not pose any problem in broad daylight, but night vision needs far better clarity to engage in safe driving. One could even have double vision in one eye when there is a high astigmatism in the same. Sore and tired eyes even after short use and a desire to keep the eyes closed to enable it to rest are the sure signs of existence of astigmatism coupled with other refractive errors like myopia or hyperopia. Photophobia is another common complaint of people affected by astigmatism. The term literally means fear of light, but actually it is the intolerance to the light to the point of being afraid of it. The scattering of light instead of getting it properly focused is due to the irregular curvature of the cornea. The amount and position of astigmatism can vary throughout life, and therefore it is imperative that the person diagnosed with the condition keep checking his eyes on a regular basis. It may worsen over time, but improvement is also not unheard of. Astigmatism is usually diagnosed during a comprehensive dilated eye examination. The evaluation of astigmatism requires an assessment of both patient's history and examination. The history should incorporate the elements of comprehensive medical eye evaluation in order to consider the patient's visual needs and any ocular pathology. Evaluation of astigmatism include visual acuity, potential visual acuity, refraction, ultrasonic pachymetry, keratometry, and video keratography. The depth of the corneal lesion can be measured using an optical pachymetry. The combination of manifest refraction, slit lamp examination, and keratometry is generally sufficient for detecting most abnormalities. A common test to confirm the presence of corneal irregularity is its successful correction with a hard contact lens and the improvement of the best corrected visual acuity with the same. So, what is the treatment modalities for astigmatism? Eyeglasses, contact lenses, and refractive surgery are the means to deal with astigmatism. All levels of astigmatism can be corrected by wearing proper prescription glasses. Eyeglasses are the simplest and the safest means of correcting a refractive error. Therefore, eyeglasses should be considered before contact lens or refractive surgery. Normally, a type of lens called spherocylinder is used to correct astigmatism. This lens, as the name suggests, is the combination of a sphere and a cylinder. The structure of this lens can be better understood by going back to the analogy of a football and a rugby ball. The curvature of a spherocylinder being not equal focuses at two different points. This ability is made use of while preparing a lens to correct astigmatism complicated with myopia and hyperopia. This spherocylinder lens can provide varying amount of plus or minus correction to each of the two meridians, making it an ideal choice for the astigmatic eye. In contrast to a spherical lens, a cylinder focuses light rays to a focal line rather than to a point. The power meridian is always 90 degrees away from the axis. Therefore, if the axis is 45 degrees, the power meridian is at 135 degrees. A cylinder is always specified by its axis. We must remember that the power of cylinder in its axis meridian is always 0. Highly irregular cornea may not benefit from a spherocylindrical lens, and the rigid contact lenses may be needed to restore good vision. Contact lenses act as the first medium to refract light rays entering the eye, thereby facilitating a more precise vision. Being very close to the eye, they provide wider field of vision, and also the comfort of the wearer is more. The surgical intervention is usually reserved for the iatrogenic astigmatism, that is, the ones which arise after cataract or corneal transplant surgery. To decrease the curvature of the cornea, relaxing incisions are made in the axis of the more plus cylinder, or alternatively placing extra sutures in the axis at right angles to this. The other surgeries include photoastigmatic refractive keratotomy, astigmatic epiLASIK, and astigmatic LASIK. In photoastigmatic refractive keratotomy, a cylindrical ablation pattern is used to remove the tissue in the chosen meridian. The axis of astigmatism is marked when the patient is seated because it may shift when the patient reclines. Currently, astigmatism of 0.5 to 10 diopters is amenable with LASIK. To conclude, astigmatism is a refractive error caused by the irregular curvature of the cornea that causes the light entering the eye to bend differently, thereby focusing at different points on the retina. The blurred image thus formed may occur at all distances because the refractive error is caused by multiple focus points. There are no indications to suggest that any particular race is affected, nor is it confined to any particular age group. Despite extensive research, reasons causing irregular curvature is not known. People with slight astigmatism live without resorting to any correction if the quality of life is not affected by the mild blurred images. But severe astigmatism has to be corrected through the use of lenses called the cylindrical lenses. These lenses adjust the focal point to fall exactly on the retina, thereby improving vision. For people not interested in wearing glasses, contact lens may be an option. Though surgery is needed in some extreme cases, it may be inevitable for permanent correction of the curvature. Thank you.